Hello, my name is Brandon, and today I'm going to be presenting the topic of HIV/AIDS and why it is still relevant today. In this presentation, I will go over an array of topics which will include the origins of the infection, how it affects the body, how it transitions from HIV to AIDS, how we can prevent the spread of the disease. We will also go over some of the common misconceptions, as well as the current state of treatment and why it is relevant to young adults and students today. To this day, there are many arguments as to how the infection, known as HIV, came to be. HIV was first discovered in human patients, dating all the way back to around 1981. Upon further research, HIV was linked to simian viruses that were known to attack their immune system. The most common belief is that humans came in contact with chimps that were infected, which led to the development of HIV. This was initially identified in homosexual men who were sexually active, and although there is strong evidence to support the origin of the infection, many opponents believe that it was engineered and spread to others intentionally, as opposed to being contracted through chimps. Now, moving on, in order to understand how significant HIV is today, we must uncover how it affects the body. In the simplest terms, HIV attacks the immune system, which makes it harder for your body to fight back against other infections or diseases. This also makes patients infected with the disease susceptible to contracting AIDS, which is significantly more severe. HIV is most commonly transmitted through blood and through sexual activity. This commonly happens through unprotected sex. Now, a surprising number of people are unaware that they are carrying the disease and end up transmitting it to another person during unprotected sex. Another common way that HIV is spread is through the sharing of needles, usually during drug-related activity. This does not always mean that it comes through drug-related activity. However, it is the most common way that it is spread via needles. Although not as common, women infected with the disease are also susceptible to passing it on to their children during pregnancy. The transition of HIV to AIDS can usually be identified through T cell counts. T cells are a form of white blood cells that help your body ward off the spread of infections and viruses. HIV significantly suppresses these levels, which are usually anywhere from around 500 to 200. Now, in comparison to a healthy human, who normally has anywhere from 500 to around 1200, this is a staggering decrease. When the infection develops into AIDS, the T cell count is around 200 or less, which is far too low for the body to properly defend and repair itself. With proper treatment, even those with AIDS can drastically improve their quality of life. However, without proper treatment, the lack of T cells in the body means that an infection or disease can be fatal. Through advancements in medicine and treatment, there is a more optimistic outlook on how those can still live fulfilling lives, especially after they have reached the stage of AIDS. Preventing the spread of HIV has come a long way since its discovery back in the 80s. When HIV was discovered, it was seen as a death sentence. There were many preventative measures taken to ensure that the spread of the infection could be maintained and even suppressed. For those not currently infected with the disease, using PrEP, which is a groundbreaking medicine, can reduce the ability to contract the disease altogether. Another effective way to ensure that the infection is not being spread is to get tested regularly. For those who are infected with the disease, preventative measures such as condoms should always be used. Those infected with the disease can only look at safe sex as their option. Those who are infected should also look for proper treatment to reduce the possible spread, which we will discuss in a couple of slides. Now, there are many common misconceptions when it comes to the disease, which leads to the spread of misinformation. The topic of HIV/AIDS is often seen as taboo, which can make it uncomfortable to discuss the reality of the disease itself. One of the most common misconceptions is that HIV can be spread through other bodily fluids, such as saliva or sweat. This makes it hard for people to want to engage in activities with people who are carrying the disease. However, this is untrue, given that the disease can only be transmitted through blood, semen, or vaginal fluids. This can commonly be found during sexual activity, and more specifically, through unprotected sex. Another common misconception of HIV and AIDS is that it is a death sentence. When the infection was initially discovered, it was a lot harder to receive proper treatment. Although it is still incurable, it is a lot easier to receive treatment that can drastically improve the quality of life for those infected. Those who receive proper treatment can have a similar life expectancy to those without it. The current state of treatment is incredibly promising, given that most people rely on at-home pill treatment in order to mitigate the infection. The most common way to treat HIV and AIDS is through antiretroviral therapy, commonly known as ART. The type of treatment is different for all patients and can vary depending on whether or not they have built resistance to other forms of treatment or whether or not they have already received treatment in the first place. Currently, doravirine is one of the newest drugs that has been implemented into the ART treatment portfolio. It is favorable because it has reduced side effects to other common drugs and can also mesh well with various combinations, whereas other drugs cannot. Doravirine is a step in the right direction toward limiting the effects of the infection and its potential development to AIDS. Proper treatment has come a long way, which has allowed those infected to carry on with their lives with greater peace of mind, knowing that they can live similarly to those without HIV. Now, we must look at why this is relevant to students and young adults today. Now, this topic is fairly taboo and one that is hard for many people to discuss. This topic is one that most people feel that they are informed on. However, as we have discussed earlier, there's a lot of misconceptions to this disease, which leads to a lot of people not knowing what they can do to prevent it or how it can spread. So, young adults and students are one of the most sexually active groups of people today. Now, within that circle, usually means that this group of people has multiple sexual partners. Now, multiple sexual partners leads to usually, at least in one case, unprotected sex. Unprotected sex is by far the most common way that HIV can be spread from person to person. Now, for people who think that they know better, they will continue to go on and have unprotected sex with multiple sexual partners, which can hopefully not lead to the contraction of the disease. I personally know somebody with the disease, and I know how hard it affects their life. And I would hope that this presentation can provide necessary information for those who would like to know more about the disease to ensure that they do not contract it, and for those who do have the disease to know that they can still live fulfilling lives. Thank you.